Is it correct to apply icing in acute injuries? This has been a question for longer times that whether we should apply ice for the patients in acute injuries or we shouldn't. So I'm going to give you accurate information about this. We know that we have been following the RICE protocol, PRICE protocol, police protocol, and right now the peace and love protocol. I hope that you guys are familiar with these protocols, but if not, you can check them out. The RICE protocol was given in 1978 and it was upgraded to the PRICE protocol in 1998. The further upgradation was made in 2012 into the police protocol, and this police protocol focuses on optimal loading. And right now we are following the peace and love protocol which was given in 2019. So what does the peace and love protocol says? So basically the peace and love protocol focuses in avoiding the anti-inflammatories, that is avoiding of anti-inflammatory medicines as they reduce tissue healing. Here nowhere icing is mentioned for the treatment in acute injury patients. So basically it turns out that icing in acute stages causes more harm to the patients rather than giving some beneficial effects. So exactly what happened in this? According to the research, it is suggested that when you are applying icing in the acute conditions, it stops the anti-inflammatory process which has to be performed by the normal body itself. Basically, we are stopping the normal functioning of the body, and because of that, healing of the condition can be prolonged. And that's why it is suggested that icing in acute injuries is not advisable and it is not permissible as well. So now again the question comes that is icing completely out of the edge or we can use it sometimes? So the answer to this is yes. Some of the research also suggests that in conditions when there is more inflammation and edema, plus for the pain recovery, icing helps a lot. So not prolonged icing but short duration icing can be beneficial in such conditions to treat and heal the conditions. So we can apply icing for less than 5 minutes, but the previous protocol suggested that it should be applied for 15 to 20 minutes, so it should be prohibited. So again, for this condition, I will advise for shorter duration icing can be given, but prolonged icing should be avoided, and that's why nowadays we are all following the peace and love protocol for the acute injuries.